why? Okay, they're getting very worried. Okay, they're saying like, what's wrong with you? You should go for a series of checkup. All the tests to make sure there's nothing in your brain. Maybe tumor, maybe something else. Who knows, right? Because the pain was so intense. So after that, I went through a series of checking tests. Luckily, nothing, is in my brain. But I found out what happened. My cholesterol was as high as 7.8. So have you all done your blood test before? No? Blood test? No? Right, one. Okay. So you're not aware of they're having blood tests or you're not there to go for blood test. I thought like going to uni, right? You need to do a body checkup, right? Isn't it? Body checkup, X-ray. I don't know when I go to UK, I need to do all that. That's called the health checkup. Before we need to be enrolled into the university. But UTAR, do they do that? I think they do, right? Yeah. Okay. So, are you aware of your own health condition? No. So, very good. Okay. All right. So, my cholesterol was very high, 7.8. So I know 7.8, right? Very high cholesterol. What will be happen? Okay? Having what? My blood vessel might clot up, right? Anyway, if it's here, we'll be having stroke, here, heart attack. So I know it's time to make a change. Okay? It's time to make a change. I know you will want to take cholesterol medicine. I'm still young in a way. So cholesterol medicine, of course, they do have their own side effects. I'm thinking to change my lifestyle, change my eating habit. So that's when my angel came in. Okay. So I want to talk about this. Is my friend. Okay, he's my angel who introduced me. Just to change my breakfast using a nutrition, changing my lifestyle. Okay, to change to control my cholesterol. During this lunch, he was asking me, "How are you lately?" I think not very good. I've been admitted to hospital emergency twice this month, and my cholesterol is very high. Then he asked me something. Oh, do you know what's your visceral fat level? I think like hospital they never check that. So come to my nutrition club, okay? I stand on a machine which you've been just like doing your wellness analysis, right? So in there, it shows my visceral fat. My visceral fat is as high as 11. I'm not fat, but my visceral fat very high. So that's why by looking at your body shape, it might not be able to show your visceral fat level. But my visceral fat level was as high as 11, and my cholesterol was at 7.8. That's like very alarming, okay? So I decided to change. Why? Because I don't want to see myself in 10 years time to be bedridden, to need to go through a very serious surgery, like maybe a bypass, or after stroke, need someone else to take care of me. Who wants this sort of lifestyle? Any one of you? No, right? So we don't want this to happen to our parents, our relatives as well. This one is very, very bad, okay? So what do I need to do then? Okay, I'll just go to my coach, I join your program, I want to lose weight. I want to lose visceral fat especially. I want to have very good control on my cholesterol, okay? That's what we call the health commitment plan. I work with my coach and use the product. Okay, that's how it looks like. That's my breakfast, okay? Very delicious. And in this 3 months, I lost 6 kg, 2 levels of my visceral fat. And my cholesterol was okay then. And now even my migraine attack has been lessened. Before that, it was like every week I'm having migraine attack, but now only 3 to 4 months once. Is that a lot better? I mean, to me, that's very good, okay? Once I've got very good results, I introduced this nutrition to my wife. My wife, she used 5 months to lose 9 kg. Give her a round of applause. Yeah. Okay. All right. Oh, online is not moving. Okay. So after that, I've got very good results. My wife has got very good results. Okay. What do I need to do? I share it with my loved ones. Okay. All right. Okay. Some technical problem. Okay. Give us a minute. Yeah. Sorry. Okay, I introduce this nutrition to my family members, to my children, to my parents, to my in-laws, because I want them to be healthy as well, right? So I introduce this nutrition to them, and every one of them has got a very good result. Okay, all right, next. Okay, in 2019 September, I opened my own nutrition center just next to my pharmacy, okay? Just next to my pharmacy. And like until now, I duplicated another 5 nutrition club in Ipoh area. So to help people, okay, to look after their health, to change their diet, to monitor their lifestyle, okay? But in the nutrition club, what we do, okay, we help people, okay, to explain their health condition, to help them to lose weight, to control their cholesterol, their sugar level, okay, and their blood pressure, okay. Over here, I would like to tell you a story, okay. The other day, okay, I went with my wife to a food store, okay, mak store. It's not a mak store, okay. So basically, it's a Chinese food store. So over there, we were sitting next to another table with 3 guys. Well, to be honest, well, guys, they can really chat. Okay, it's not just ladies. So these 3 old men, okay, one of them was saying, "Oh, my cholesterol is high. I just received my blood results. Okay, it's 5.8." The other old man told him, you know what he said? "No worries. I'm 6.2. I'm not even taking medicine." Okay, and the third one, the other older guy was saying, "Don't be silly. I've got 3 highs. I've got cholesterol. I'm a diabetic, and I've got very high blood pressure. I don't even always take my medicine." I mean, if you are mixing around with this sort of, friends, so what would your life be? What we say, you're waiting, for your turn to have heart attack, waiting for your turn to have stroke, right? So in the nutrition club, what we do, we all talking about health. Because in a very good environment, a very good platform to promote health. So that's why in the nutrition club, I'm looking 5 cancer patients, a lot of customers with like cholesterol, high cholesterol, diabetic, okay, even high sugar, cholesterol, hypertension. Okay, in the nutrition club, we do a lot of like different activities. We lose weight, we become healthier, and yet we do have a lot of activities together. Okay, we do different shape for people like their birthday. We celebrate different kind of occasion. We're having all this. Okay, so I think when you come to losing weight, you want to become healthy, and yet you enjoy the moment. Okay, so that's what we do. Okay, so a lot of our big community, we're doing mooncake, we're looking after them. We want to become healthier. Okay, we work towards it. That's how it looks like. Our breakfast, okay, our dessert. So basically, you want to lose weight. Wow, it's just amazing. It can be very fun. You will enjoy it. So morning, okay. Morning, I'll be in my nutrition club. Okay. After 11, I'll go back to my pharmacy to do my job as a pharmacist. Okay. Still looking after patient. Okay. That's what we do. We do sharing like this. We educate people. We help them to become healthier. Okay. So basically, continuously to educate the public and share the correct concept of nutrition. Okay. Okay. So all these nutrition clubs over the world, all around the world, there are 120,000 nutrition clubs all over the world, globally. Okay. But like, why do we need so much of nutrition club to look after this community, big community around the world? It's because nowadays a lot of people they are having this problem, high visceral fat, which I just explained. Okay, wow, amazing. Malaysia was that having very bad condition now. Cardiovascular diseases is our #1 killer. It's not accident, it's not cancer, but cardiovascular disease is the #1 killer in Malaysia. And 1 in 4 Malaysians dies from heart attack. When someone passed away, 25% of them is because of heart attack. It's not I said it, it's on the news. Okay? So this one, 50% of Malaysians do not know their health status. Okay? So they ask, do you know your own blood pressure? The reading? Do you know that? But maybe someone don't even check it. Your cholesterol level, your sugar level, do you know that? Or how often do you check it? So basically, according to the news, you're saying like 50% of Malaysians, they don't know their health condition. They don't know their health status. Okay? So all these non-communicable diseases are on the rise, which means it's the 3 highs. Even you stay at home, you're not going out, you might be getting high blood pressure, you might be getting high sugar level or high cholesterol. This one what we call NCD, non-communicable diseases. Okay? And nearly half of Malaysians are having high cholesterol. I'm just one of them. Okay? So now I told you, I don't look fat, but my cholesterol is very high, 7.8. So I'm just one of them. 1 out of 2. So it's good to go for a blood test. Okay? That's the only way to check how high is your cholesterol. And over here, it shows ladies have got a higher chances to have high cholesterol. Why? You know why? It's because they like to eat fried food. They like to eat tidbits. Ladies more stress? No, I think men do have stress as well, right? So no, it's because ladies that do have female hormone, right? Once they're past, they're having what's they call it? Menopause, yes. Having menopause, they won't have the protection. Then usually ladies would have high cholesterol, high blood pressure. That's why ladies is having slightly higher percentage of having high cholesterol. And over here, 1 in 5 Malaysian has diabetes. Wow, 1 in 5 means 20% of our population. Okay, we are being a diabetic, and yet this one is the one has reported. But how about the other 50%? They never notice their own health status. They might not be even detected. That's why we need to create more awareness, to ask our family members to do a regular checkup, to see a doctor, to check on their own health status. Okay? Right. Wow, amazing. The most overweight nation is Southeast Asia. Yes, Malaysia bought it. Right? It's not I said it, it's on the news. So basically, now I just checked online. I think the before that it was 50%. Now it's 54.4% Malaysian are being overweight. Means you throw a stone on the street, you kena one, they are fat. 50% chances. Amazing, right? So all these figure, I don't know whether when you look at it, a lot of people might pay no attention, but to me, as a healthcare professional, we say it's very alarming. Because you're not careful, it might climb up to 60%. Okay, that's very bad. And all this will actually put burden on our government. You see what happened? So if we are fat, where you will give us more problem. We're having joint diseases, chances of being a diabetic is 5 times higher when you're fat. 5 times higher. So is that just a figure to you, or is that really alarming? So when a person is fat, they put on weight, chances to have hypertension is 3.5 times higher. It's not just a figure, it means we are all at risk, right? So we need to do something, because when we are obese, we have problem from head to toe. It's not just having 3 highs. We could be having what? Here, we're having stroke, having uric acid, having cancer. Even during COVID time, obese people who have COVID actually have a very bad impact on them. Usually people admitted, people pass away, is because they're obese with COVID attack. So that's because when we're obese, our immune system is being compromised as well. So we need to do something, okay? Next. Wow, this picture, is a bit hard to look at, but to be honest, this one is a diabetic patient when they are not having a very good control. You're having gangrene, okay? They're having big sore, and you're not careful, you need to be amputated. You need to potong, okay? That's how it will happen if you're not having a very good control. Even infection will set in, you see? Just a minor eye infection will turn into that. You can't even open your eyes. That to me is very alarming, and yet a lot of people, they are not aware of it. They think it's just high sugar level. But outcome will be like this if you're not careful, okay? So the good news is, if you can lose just 1 kg, you can actually drop what? Your blood pressure, your cholesterol. Isn't that amazing? Just 1 kg, it has shown some results. And how about if you lose 5 to 10% of it, you can actually do more. Even your sugar level, your good cholesterol will be up. I think, isn't that amazing? If I'm 80 kg, 5% only 4 kg. 10% will be 8 kg if I'm 80 kg. So that's not a lot. If you really want to lose weight, you can actually help your body, to become healthier. So when we are obese, we are big, basically our body is crying. It's crying for help. You can just lose a bit, you can actually help your system, your body to become healthier, okay? Next. So, it's the same slide. Do you know your visceral fat level, okay? This machine will help you to detect, okay? So just now I did mention, you might look thin outside like myself, but fat inside means the visceral fat very high. So a lot of people will be like this. They look slim, but a bit of tummy. That could be high visceral fat as well. Okay, here I'll show you this. They are twins, but just by looking at their face, their size, I think the left-hand side looks slimmer, right? But look at the body fat, 21.2%. But this guy look a bit tough, but they're all muscle. His body fat is only 9.1. So basically, by looking at a person, you won't be able to tell the body fat percentage, okay? So people might have the same waistline, but the muscle mass content or the body fat or visceral fat level, it won't be the same. Only by doing the standing on the weighing machine, you know your own body fat level. Okay. See this one, same waistline but different body fat level. So sometimes you say, oh, I look thin, but you might not be healthy. Okay, next. Okay, this one slide I just mentioned. Next. Okay. Well, in this modern era, right? A lot of gym, a lot of like health food store, a lot of what's that activity for you to become healthier, organic food, supplement, a lot of pharmacies around. Okay, but why? Did you ever think why more people are getting sick? You look at the hospital, right? Long queue, and more hospital need to set up just because they need to accommodate more patients. But why is that? Everyone says they are looking after themselves well, they are healthy. But why is it? Did you ever think about that? What is the root of the problem? Okay. So by looking at this, the healthy food pyramid, I'm sure everyone has seen it, right? Okay, I'm sure we learned it even school days. Okay. So do you know what nutrition you had today? This morning, what did you have for your breakfast? Or no breakfast? No breakfast. Wow. Okay. No breakfast because no time, or money constraint, or being lazy, not be able to prepare it. Okay. Because and even you do eat breakfast, right? Do you know how much nutrition you had for your breakfast? Did you ever check? Maybe only carbs, any protein in there, any fiber in there. A lot of people don't. Maybe just a bun. They're saying like, okay, that's good enough for me to keep me full, keep me going. But that's not healthy. But whenever we want to eat, we try to eat a balanced nutrition meal. Balanced nutrition means you should have fiber, you should have carbs, you should have protein. Okay, that's what we call balanced nutrition. That's why nowadays a lot of dietitians, nutritionists, even pharmacists, you try to educate people to have a balanced nutrition diet. Okay. Some people say, "Oh, I do eat," but I can tell you, even you do eat food, it doesn't mean that you are getting the right nutrition. It's because nowadays they want mass production. Okay, they will keep a lot, chicken, but now the chicken is only 45 days in order to be able to sell. But I think like 10, 20 years ago, you want to rear a chicken, you need to wait what, 3 months, up to 5 months, in order to be big enough for us to consume. But now, because of the hormone, because of the medicine, we can rear a chicken just 45 days will be out on your plate for you to eat. So that's how it okay. So over here, I'm sorry, they're Mandarin, but basically it says all this fast food, the chicken, they only keep for 45 days to be out, and usually they use a lot of antibiotic. It's on the newspaper, okay? So another cancer-causing food that most students will like it. Do you eat all this? Hot dog, burger, donut, fries, and chips and crackers. But according to WHO, this one is the cancer-causing food. But maybe you are young, but let me warn you, whatever you are taking now, it might reflect 5 to 10 years later. So you might be okay now, but you're eating all this because you may be young. But how about 5 years or 10 years later? You won't know. That's why on hand, the prescription come to me for cholesterol medicine, the youngest. Make a wild guess. How old is the patient? 25? 30 years old? I received the prescription. I was shocked. I was saying like, hey, could it be wrong name or wrong age? So I asked the mom, is that for your husband? The mom said, no. This prescription is for my son. He's only 18 years old and he needs to take cholesterol medicine. Why? He's very active. Okay, he's playing basketball every single day in the evening. But after the basketball session, you know what he takes? 2 bowls of the curry mee or double up because like very active. 2 fried mee hoon and then like teh tarik or whatever. So now all these diseases, non-NCD diseases, right? It doesn't need to be you are 40 or 50 to get it. You can always get it as young as 18 or 20 years old. Okay? So it's not, I'm not here to scare you, okay? But that's the real thing happened in my pharmacy. 18 years old. Okay? Right? Next. So anyone of you drinking all this Coke or even like all the Snickers, Skittles, or even Haagen-Dazs. But all this is nice to drink, nice to eat. But did you ever check on their sugar content? Why Malaysian? 20% of Malaysian they are all being a diabetic is because of this. What we call hidden sugar in our food. You eat it, you don't even notice there are plenty of sugar in there. Okay, that's why this one type 2 diabetes take over teens role. So it doesn't need to be 40 years old, 50 years old to become a diabetic. Now, even as young as what 15 years and above, you do have a chance to become a diabetic. It's because what we eat. Okay. All right. Next. So all these look familiar to you? 100 plus, some people might think it's very healthy, right? But 1 can of it, how many tablespoons of sugar in it? 5. 5 tablespoons, okay? And how about the bubble tea? Anyone like bubble tea here? It's not too bad, only 15 teaspoons of sugar. Okay? But do you know that as an adult, okay, WHO recommended as an adult, do you know how many teaspoons of sugar we can take in a day? Anyone aware of that? WHO, according to WHO, for an adult, how much sugar we can take in a day? Only 9 teaspoons. But if you take 1 bubble tea, gone. Or already what? 15, okay? Or even like you take some our ketchup, they do have sugar in it. We do have our chili sauce, they do have sugar in it. Chili sauce is no longer only chili, okay? They do have plenty of sugar in it. So that's why a lot of people say, I don't really eat sweet things, but I don't know why I become a diabetic. Of course, you use a lot of ketchup, you use a lot of chili sauce, they're all sugar. They're all sugar in it. Even Cocoa Crunch, you can finish the whole thing, 13 teaspoons in there. Anyone eat cereal here for morning? Cereal and milk? No? Wow, very healthy, or no breakfast? Or no breakfast, okay? All right, next. See, high sugar drinks, and yet look at the crowd, look at the queue. We think like that's why Malaysian getting more and more Malaysian become diabetic. Okay. All right. So I would like to ask, okay, if I'm a diabetic, would you ask me to go for white rice, brown rice, or basmati rice? Which one would be healthier for me? Brown rice, white rice, basmati. But some people told me basmati is better because more expensive. Is it right? But any one of you at home using basmati rice? No? Oh, okay. Oh, you do, right? Okay, let me tell you. Okay, right? White rice and brown rice, calories are the same, and the amount of sugar goes into the body is the same. It's just, like for science, the surface area is the same, but one is peak, one is like slower, but the surface area is the same. Means the amount of sugar gets into the body is the same. So if I'm a diabetic, okay, even I'm taking brown rice, I still need to take half a bowl. Right? Does that make sense? Because the amount of sugar goes in the body once being digested is the same. All right? So whoever having relatives or friends having being a diabetic, please advise them. Even you're taking brown rice, portion size is the most important thing. Okay? So how about basmati? Okay? Look at it. It's still the same. You're paying more, but the amount of sugar gets in the body is the same. Okay? So it's still the portion size after all. Okay? Why I put out these slides? Anyone keeping cats or dogs at home? So when we go out to buy food for them, we check. After taking this, I make sure the fur looks better, it won't drop, and maybe this one is higher calcium, it's good for their bone. I buy something for their teeth, right? Pets lover, would you do that, right? But no one keep cats or dogs here? Oh, okay, only one. Wow, the rest, all money for yourself, buy things for yourself, right? No pets at all, okay? But a lot of people with their pets lover, honestly, they spend money, they spend time to look at all the ingredients. But may I ask, did you ever check what are you feeding yourself? What do you give yourself? For your children, for yourself, for your family, did you ever check the nutrition value? The vitamins, the proteins, the fiber, the fat, the minerals, and all that. Did you ever check? We don't. Kenyang sudah. Is that all? Is that all you do? Like you just feed yourself because you want to fill your stomach? You never look at the nutrition, right? Okay? Right. How about this? Familiar? Are you taking it daily? No? Never try this? Being a Malaysian, are you sure? Okay, so all this is good to look at, it's good to eat, of course it's delicious, but how about the nutrition value? Is it good for ourselves? Okay, but long term, having all this, to be honest, is no good. All right, okay, next. Okay, wow, is it cute? Cute, right? But do you know that all this because of parents? That's how we feed them. So if we are having we look after ourselves, we are having a balanced nutrition, I'm sure they won't become as cute as this. So it's because your kid eats what you eat. So parents eat what we feed them. It's the same thing. So it's good to look after our own food, balanced nutrition, so we will be able to look after them as well. Okay. Wow, look at this. This one is on the news. Singju, 90% of sudden death are related to heart diseases. It's on the news. So that's why now, even you do exercise, it doesn't mean that your health is being guaranteed. Exercise doesn't mean that you're healthy. And I'm sure you receive news like playing a badminton player, they just collapse, right? Why is it? All because of heart attack, mainly due to heart, okay? They do have hidden risk, which is heart diseases. You look fit, you look okay, but it doesn't mean that your heart is okay. That's why it's good to do a regular checkup, okay? To go for health screening, to look after yourself, okay? But over here, I would like to highlight every one of us, we are all unique, okay? You won't be the same, and yet, we need the same basic nutrition. That's how it works. So, if our cells are healthy, then overall, our organ will be healthy, our system will be healthy, overall, the whole body will be healthy. So, every one of us, we need the same basic nutrition, okay? So here I need to highlight a bit. If you are having a very good nutrition, you will be okay. But when you are starting to have like small problem, means like always having flu, not well, fever, you are having malnutrition, maybe 75%. But when you come to 50%, not having nutrition, you're having a lot more problem. Backache, you're having like lots of memory, even your eyesight will be bad, okay? So even if your nutrition is depleting again, you might having cancer, having other problem, okay? So we need nutrition. That's the fuel, all right, for our cells, for our body, okay? So do you know that most of these chronic diseases is due to what? Nutritional imbalance. Amazing, right? So as simple as like insomnia, headache, skin problem, osteoporosis, they'll start from imbalanced nutrition. So osteoporosis, I'm sure a lot of people know because not enough calcium, right? So not enough iron, we have what? It's here, right? Not enough iron. What's that? Being anemia. So all this is because, of course, they do have other problems that will cause anemia. But if you are not having enough iron, chances to have being anemic is there. Okay. So all this, as I say, is because of nutritional imbalance. Okay. So in order to become healthier, what do we need to do? Okay. You just need to fulfill these few things. Okay. Need to have ideal body fat. Why? Because if you do have ideal body fat and visceral fat, minimum chronic inflammation, that will become healthier. Balanced nutrition, as I say, if your cell is healthy, okay, overall, you become healthier. Moderate exercise will enhance the blood flow. It's good for the brain. It's good for our muscle, okay? We need to get adequate sleep. I know a lot of uni students, they don't get enough sleep. They sleep late, okay? It's because due to maybe they are very hardworking, or maybe due to computer games, okay? Or maybe due to some other things. Not enough sleep will actually affect your performance, okay? And you need to control your mood. You need to have a very healthy habit, means like need to cleanliness, and need to drink enough water, okay? Whatever you do, water is very important, okay? For a human, our whole body, 70% they are all water. So if you're not having enough water, you cause a lot of problem. You may be having skin problem, you may be having some kidney problem later on. So water is very essential, okay? So it's time to review your eating habit. After, listening to me, would you go for this right-hand side lady, happily taking all the vegetables, or you still prefer fast food? No idea. Or we stick to your normal routine, okay? Next. Okay? I just want to highlight all these common breakfast, Malaysian breakfast, okay? Fried mee hoon, roti canai, nasi lemak, mee goreng, bread, oats, Milo. Anyone like Milo? Milo? No? Oh, only one. Okay. Or no breakfast. See, all the breakfast, Malaysian breakfast, they're all high in carbs. Look at the yellow beet, they're all high in carbs. Protein, very minimum, some of them even very high fat, especially mee goreng, okay? So all these, to be honest, in terms of nutritional value, no good. We would prefer you to have more fiber, enough protein, minimum carbs, in order to minimize the NCD problem, okay? So why we try to minimize all this common food, as I say. After taking high carbs meal, our sugar will rise, okay? Of course, our body will do job. What we do? We release insulin to bring down the sugar, right? I'm sure everyone knows. But if by doing this, we actually bring down lower. That's why I'm sure over here, they do have some students or even like lecturers, after having a meal, not even 2 hours, say, wah, macam lapar lagi, right? Or even after a big meal, especially noon, always mengantuk, right? Because sugar rush. So they can't pay attention, they want to sleep, is because of this. By doing this, over the years, you put on weight. Because like body will try to convert all the yellow beet, the high sugar level, they will turn into fat. That's why a lot of people say, could it be aging? No. It's because that's how we eat, okay? Wow, this book is amazing, okay? They're saying like, in these 200 years, they discover one thing. Human only get one disease, which is what? Cell malfunction. So when your cell is not healthy, it leads to a lot of things. This is not right. I show it to you. The chronic diseases is because of imbalanced nutrition. It's because of this. You start off with one cell. If you're not careful, more cells will involve, and the system involved, then we're having problems. That's how it works. So in order to overcome this, we need to do something to look after our cells. So that will be our cellular nutrition, okay? So we need to feed ourselves with the right nutrition. It's because a healthier cells, they will be able to absorb nutrition to excrete our waste product. That's how it works, okay? Better absorption and waste pass out better, then we have a healthier body, okay? So this one is the condition. We need to, the place that we absorb nutrition is our intestine, okay, the villi. So we need to make sure our villi is healthy, okay? So what is the challenge we are facing? As I just say, we need more protein, we need to look after the calories, we need to have more veg, then we will be able to, fill my stomach, okay? And we need to minimize trans fat and cholesterol. So, if we go out to eat, to buy something, that's the challenge we face every day, okay? We need to have a balanced nutrition, and yet, how to do it? Not unless you do your own cooking. We are buying outside, honestly, you need to face all these problems, okay? So that's why you need a health coach, okay, to guide you, to motivate you, and give you a set broad goal. So basically, we use a holistic approach to make sure you can lose weight, become healthier. That's what we do in our nutrition club, okay? So that's what I joined for this program, Janji Sehat, PJS, to bring down my cholesterol level, to lose fat, to lose weight. Okay, today when you're here, because like in Utah, a lot of students here, so I need to highlight a bit regarding health and academic performance. Would you like to know more? Do you want to score better CGPA, right? Right? So 2.5 is good enough for you, or you want 3.5 and above, or 3.8? You want to be in the thin list? Right? So if you can look after yourself, okay, feed yourself good, and I give you a few tips how to score better. You want to know more? Okay. Well, amazing. When I check online, UTAR itself, they've done the research for people, for students who sleep less than 7 hours. Usually their score, CGPA will be lower. Anyone sleep more than 7 hours a day? None of you? 12 hours. Are you sure? But maybe you sleep very late. You sleep at 4 in the morning? Oh, wow. That's not healthy, okay? So that's a bit abnormal. But like, to be honest, for an adult, we need to sleep at least 7 hours. But 12 hours like him, that's a bit abnormal, right? Okay, so it's not, I say, it's based on the research. It's UTAR Kampa research. They've done a research on this, okay? So sleep is very important. So I mean, some people maybe they stay up late just want to study, but some people they stay up late because of gaming. They play games, okay? So that would be not a healthy way to do it, okay? Next. Okay, poor health equals to poor learning. If you are not healthy, you won't be able to put all the information into your brain. So lack of sleep, okay, will lead to poor memory. That's why people, if you are not resting enough, you're not having good sleep, you can't actually put all the information, all the books, put in your mind. Because sleep is essential for memory consolidation. So you want to perform better, you need to have a good night's sleep and never skip meal. If you skip breakfast, actually lower energy. We need energy for our brain. So that's why breakfast is the most important meal of the day. But, and yet, I know a lot of students, they don't eat breakfast. So please change. You tried it for a few months, I'm sure you'll notice, hey, why my memory is better, why I can score better. Because we need food, okay, for our brain. Do a bit of exercise, because exercise will enhance circulation, will give more oxygen to the brain, you can have a better focus. So no exercise means lack of focus, okay? So this one is all based on research. Another thing, I do have students telling me, they're saying like stress. Yeah, right? High stress can actually burn out our brain cells, okay? So it means that you won't be able to concentrate, you won't be able to absorb all the information. So chronic stress basically will reduce your academic performance, okay? So over here, this one is the Malaysian health crisis. It applies to all the students as well. Overweight, even like people 18 and above, they might be having a bit of hypertension as well. Another thing would be among the university students, right? They're having a bit of mental health needs. They're having stress. They're having a bit of depression, anxiety. It's very common now. So based on them during pandemic, around 50% of the students they are having depression. Okay, so this one we need to know how to handle our stress. So you want to handle stress, it's not difficult. You can do a bit of exercise, you can do meditation, listen to songs, or you can get someone else to chat, get a partner, to chat with them. Okay. Student lifestyle habit, very common, okay? Skipping breakfast, I just mentioned insufficient sleep, empty-calorie food. This one I need to highlight a bit. When they say empty-calorie food means it's high sugar, high fat, but no other values. Means all the fried food, all the bubble tea, all the sweet things, sweet drinks, they're all called empty-calorie food, okay? High stress level, okay? So what happens to your brain, okay, if you don't sleep well? We increase other risks as well. Even being obese, having like chances to have other problem, even immunodeficiency means, I don't know whether you notice, you're not getting enough sleep, usually you get runny nose or flu easier, right? It's because your immune system is being compromised, okay? So lack of nutrient as well will actually sluggish our neurotransmitter, means will affect our dopamine, all these neurotransmitter, then will affect our mood, okay? And stress hormone, okay? If you're too stressed out, it can block our learning. You don't have the mood, or you can't even concentrate. Sleep as well, you impair memory. Obese, okay, will cause inflammation. You don't feel good, you don't feel healthy, you won't be able to carry on with our studies. Yeah. So myth and reality. A lot of people say, I still can function well, just 4 hours of sleep, right? A lot of students say that, okay, I sleep 3 hours, I can still go to class, okay? But to be honest, according to the research, no. Long run, you can never do that, okay? And I think skipping meals might help me stay focused. No. Breakfast is the most important meal of the day, okay? Stress is just part of student life. I can handle it. No. When you're having stress, it's good to go for, to tell someone or go for a counselor or tell your lecturers. I'm sure they'll give you some good advice, okay? I don't have time to exercise. No. Exercise is not difficult. Even 5 minutes or 7 minutes exercise is good enough to increase your circulation and increase the oxygen supply to our brain, okay? All right, so for time management, I don't know whether you know about this technique, Pomodoro technique, okay? So what does it mean, okay? You need to concentrate 25 minutes, then you rest for 5 minutes, 25 minutes, 5 minutes. You do that, it can actually give you a better concentration, having a better memory on what they have just done. You try it that way, rather than you sit there for 4 hours, not doing any, just read, you won't be able to put anything in. That's the technique, is proven, it works, okay? Or using a digital tool. I'm sure the Google Calendar, smartphone everywhere, I'm sure you can do this, okay? You can plan ahead with your schedule, okay? And prioritize your meal, your rest, and activities. Everything can be done, okay? Next. Okay, eat smart for students, okay? Then you will think smart, okay? Why is that? If you go for bubble tea or Milo and all that, you swap, okay? Protein shake. Because we need protein, okay? For you to perform, for you to increase your immune system, we need all protein. And if you go for all this, roti canai as well, you swap it with oats and eggs, okay? That's not expensive at all. And if you want to soft drinks, please swap it with water, with lemon or mint. That's a healthy way to do it. Because I know some customers, they say, I don't like to drink water, it's tasteless. It's okay, you can use lemon, but it doesn't need to be go for all these soft drinks, high sugary drinks, okay? So eat smart, then you have like, you can think smart. This one is all the food that is good for our brain, okay? So means omega-3, which is from fish, from egg, from some nuts. And we do have like all these cherry tomatoes, blueberries, broccoli, and even the avocado. All this food has been classified. It's good for our brain. So, I mean, if you do cook for yourself, please, you can always look for this food. So you need to move a bit, move more, and your brain will function better, then you can think better. A lot of people say, I don't have time to exercise. Steps, 10,000 steps is good enough. If you do walk a lot, that's good enough. Or just a 7 minutes workout. 7 minutes, I'm sure you spend more time in the toilet, right? People spend more time in the toilet. So 7 minutes doing exercise, I think is reasonable, okay? And manage your brain. But over here, they do one technique called 4-7-8 breathing. So basically, you inhale, count to 4, hold it for 7 counts, and exhale for the 8 counts. So that you'll be able to de-stress. You can always try it, but this one is proven and it does help. Okay, so when you're very stressed out, you can always use this technique, okay, to do it. Or you can use some goals to let you focus better, okay? So when you can hit your goals and you'll be happier, okay? Small goals, yeah. Thanks. So this one is our community health mindset, okay? Let's take a moment to reflect, okay? Reactive health, seek behavior, okay? So basically seek medical attention only after symptoms become severe. So a lot of people do that. They never see a doctor, they never do checkup, not until they're being admitted to hospital. That's no good. So you should do checkup regularly, okay? Another thing will be, the young one will be healthy. It doesn't mean you're young means you're healthy. No. As I just mentioned, the prescription that I received for taking cholesterol medicine, 18 years old. And now, type 2 diabetes has stepped into teens. So means 15 years old and above, your chances to become a diabetic, okay? So, you need more young health advocates. Means like, if you are very health conscious, you can actually influence the others. That's very important, okay? So here I do have some product results. You know, I've been doing this for many years. I've been helping a lot of people to become healthier. So this Madam Wong, okay, she came to me. She's a retiree. She's been taking blood pressure medicine called Nova's Pen Energy for 10 years. Okay, she came. She only used 3 months to lose 10.8 kg, 7% of the body fat, and 3 layers of the visceral fat. Okay? After 6 months, doctor stopped her medication. She was so happy. The same like, I've been using the blood pressure medicine for 10 years. I didn't expect doctor would stop my medication. Why? Because her blood pressure goes very low, and even after stopping, okay, the medication, her blood pressure is still 1 something below 70 plus. Isn't it good? So she was saying like, is this a blessing, honestly? No need to take medicine now. Okay, next. So this one is Kat Rosanna. She's only 38 years old. And her fasting sugar level is 14.5. She was saying like, tak tahu mengapa selalu rasa letih. So when she checked, her sugar level is 14.5. And she was so shocked. I said like, I can never believe I am having such a high sugar level. But like just within months, less than a year, she dropped 14.6 kg, 14 kg of it, they're all body fat, and 4 layers of visceral fat. And now her sugar level is always, fasting is only 5, or sometimes 5 point something. Isn't it good? No medication. Just by changing lifestyle and eating habit with a good nutrition, you get that results. Yeah, give her a round of applause. I really salute her. She said like, saya tak mau makan ubat. Saya betul-betul nak buka cara hidup dengan cara makan. I think that's amazing. Yeah, next. Right, this one, a very classic customer, a diabetic, has been diabetic using insulin for more than 10 years. And yet, her fasting sugar is still 18.5, okay? So when she came to me, she was saying like, tak tahu mengapa saya pun tak makan nasi, tapi gula masih tinggi. I said, betul ke? So when I sit down and go through her meal plan, you know what she eats? She doesn't eat rice. But she says she's a teacher, she will need to eat, right? If not, how to teach? Yes, she's having bread, white bread. Tak makan nasi, tapi makan roti. Then I told her, huh? Nasi dengan roti sama, they're all carbs. So by changing the way she eat, like within 3 months, her sugar dropped to 6.3. And after that, the insulin she injecting used to be 22, 24 units. but now only 8, sometimes only 6. Isn't that amazing? Yeah, she's been doing insulin injection for so long, more than 10 years. Okay, next. Okay, this guy is a sales manager, a lot of entertainment, he's smoking, drinking, blood pressure very high. He's taking 4 types of medication for his blood pressure. Still 168/95. When he walks in to my pharmacy, it's like punching because the heart is inflamed. Okay, so the doctor told him, if you're not doing anything, you might get heart attack anytime. So he was with us for 3 months. He dropped 8 kg. Okay, during these 3 months, his blood pressure has dropped down to 118/71. I would say that's amazing. Just by losing weight, just now I show you the slide, right? You just lose 10% of your weight, your blood pressure, your cholesterol, even your sugar, you have a very good control. Okay, next. All right, this one is Uncle Ravin. Okay, 3 highs, diabetic, okay, high cholesterol, high blood pressure. He's taking 5 types of medication. He goes to Permaisuri by noon to take his medicine. But after 6 months with us, we changed the way he eats with a good nutrition. Doctor stopped 2 medicine. Now he's only taking 3. He's so happy after reducing the medication. His blood pressure is still good. Sugar is still very good. It's still 5 point something. See there, 5.7. Every day, it's like a normal person. That's how amazing it is. Okay, next. Okay, always talking about losing weight. We do have customer who want to gain weight, right? So by changing the way he eats with a good nutrition, he gained 20 kg, but in 1.5 years. He always saying like, the first picture, I look like a monkey, okay? And this one, I look like a real man, okay? So with a good nutrition, you can do a lot. It's not just to lose weight, but you can gain weight, you can become healthier. This one is another guy as well, okay? To gain weight. I don't know why guys usually need to gain weight. Is that right? Not really. Just like the red one, okay? So this one, some people will want to become muscular. To become muscular, of course, you need to do a lot of workout, need to go to the gym, but don't forget a good nutrition, okay? You still need to get a good nutrition to gain, to increase your muscle mass, to have your 6 packs, okay? So this lady, S.T. Hui, she came to my pharmacy with a very bad backache. So she says she want to get the back support, right? Backache, you need a back support. So I think like if you're getting a back support, this helps you temporarily. But did the doctor ask you to reduce weight? She said yes, but I don't know how. So being a pharmacist, being a wellness coach, I teach her how to lose weight. In just 3 months, she lost 12 kg, 8% of body fat, okay, 2 layers of visceral fat. Now she's got no more backache. She didn't even need to buy the back support. Isn't it good? So losing weight, you can actually get rid of the underlying problem rather than just sell her the back support for temporary relief. Okay? So we've been doing this, helping a lot of people to become healthier, become more confident. Okay? So that's what we do in my pharmacy, my nutrition club. Okay? So basically, just now, whatever I showed, okay, this one is just food, okay? Nutrition itself will feed our body become healthier, okay? But when you become healthier, a lot of problems will be solved, okay? So basically, it's really seriously, you need to help people to become healthier, that's it, okay? So we all deserve a better and more fulfilling life. That's what I always feel. So we are all here to enjoy life. We're in this world. Of course, we do our best, okay, to help people, okay? Okay, that's my sharing until now. So I'll pass the mic to the MC. Thank you.
you, Mr. Desmond, for your wonderful sharing and comprehensive sharing. So from now on, I think I will need to pay extra attention to what I eat every day. All right. So now, ladies and gentlemen, we are now moving to the next session. All right. Our next speaker is Anjay Husni Suhaimi. Okay, allow me to talk a little background of Anjay. Anjay is a dynamic and passionate health professional with a robust academic background. He graduated from University Science Malaysia in 2010 with a Bachelor of Health Sciences, Dietetic, and earned his Master of Science Nutrition in 2015. His deep-rooted passion in nutrition and dietetics has seen him actively participate in various health promotion programs. Currently, he imparts his expertise as a lecturer in dietetics at UTAR and is frequently engaged as a speaker in health talks, seminars, and forums on nutrition-related topics. His dedication to research is evident from his presentation at both local and international conferences, complemented by several published academic journals. In addition to his impressive academic portfolio, Enzo is also known for his strong sporting background, from competing at the national level in volleyball to his ongoing commitment as a fitness trainer at Six Base Sport Arena in Kampar. Now, ladies and gentlemen, it is my honor to invite Enzo to the stage for his presentation titled Nutrition Strategies for Enhanced Productivity. Yeah, let's welcome Enzo.
Saya nak tolong tekan sini sebab saya akan skip banyak slide.
Okay, good afternoon everyone. Thank you, Mr. MC. I think most of my presentation I think being covered by Mr. Desmond already, but maybe I can maybe pop up a little bit a few more information. Okay, today I'm going to talk about the nutrition strategy to enhance productivity. Okay, you can proceed. Okay, so by my background is I'm a dietitian and currently I'm a lecturer for dietetics program. Other than that, next, I'm also was athlete, state athlete. I compete at national level last time. My main sport is volleyball, but now I retired already, so I switched to badminton due to certain reason. Okay. Actually, I have a quite many slides, but maybe please forgive me if I skip a lot of my slides because it's kind of redundant already, but it's okay. Just to let all of you know that in UTAR, I'm teaching mostly two core subjects. Number one is MNT, Medical Nutrition Therapy, for specific diseases. So there will be specific guideline for diabetes mellitus, hypertension, hyperlipidemia, and so on. Being an academician, one of the challenging things when we teach people is we have to practice EBP, evidence-based practice. Everything I want to deliver to people, it must be proven through series of study. If let's say I want to say, okay, you have to consume 3 serving of vegetable, 2 serving of fruit. Even that sounds very simple, but it must be proven through of studies. So forgive me if let's say in my lecture I include some of academic things a little bit, got some journal or what, because this is the way I practice as a lecturer. Okay, and okay, when another subject I'm also teaching about the nutrition for athletes. I was an athlete and also I'm taking nutrition for athletes as well. Okay, if you see my background, you can see that I focus more on nutrition for cure the disease, right? And also for my background, I was an athlete, so I focus on nutrition for athletes as well. But now my personal interest is more on nutrition for longevity because I'm getting older. So actually, one of the reasons I take this course is for myself actually. So after I explore this course, and then I feel very blessed to learn this course. I can apply for myself, and also I can apply to, I can share to my friend, my family members, and so on. Okay? So, lately, how to say, currently I'm under recovery process. I got the ACL injury. This is my second time. I got ACL injury during badminton competition. Sometimes I cannot control my, how to say, my spirit in sport. I cannot control. Sometimes when we go over the limits, we tend to have a surgery. But it's very common for athletes. No problem at all. If we got surgery, we go surgery. Okay, let me start my talk today by telling you my routine, my daily routine. So I can share some of my how to say habit. That I could say I practice healthy lifestyle habit. Okay, I wake up around 6 p.m. Wake up, perform some prayer, and after that I take some breakfast, and then I come to the school, to the university. Normally I will enter office around 8, and then I finish my work around 6. After that, I will proceed to the gym. Around 6:30, 6:15, 6:30 like that, until 7:30. After that, I go back, take my dinner, and do some of my work, and then I sleep. And I go to the gym almost every day. But I could say on average, like maybe 4 to 5 days a week. Some of my colleagues, when he know me that I always go to the gym, some of them they ask me, "Hey, Mr. So, don't you feel tired? You go to the gym every day?" I reply to them, "I'm okay with that. I can cope." But actually, the best answer for them, for me to answer, to reply their question is actually by giving a complete knowledge. Actually, I can cope with this, how to say, lifestyle. It's come from my nutrition. Okay, it's come from my nutrition. And sometimes, because now I'm switched to badminton, last week, just to share with you, one of my teammates, badminton, if not mistaken, on last Tuesday, we finished our badminton around 10 like that. Around 12 a.m. in the midnight, we received a WhatsApp group. One of our teammates just passed away. He's quite, how to say, he just the age of 50 something, and he's not fat. But then when I asked my other teammate what is the reason why he passed away, it's due to the heart attack. So it's very important for you, for us, to really care of our health. Okay? So now, because I cannot play badminton at the moment, so I focus more on workout. Okay? When I go to workout, I take picture, I share to my friend. It's not like I want to show off my body or what. My intention is I want to, how to say, encourage them, give them some spirit, that we practice healthy lifestyle. Okay? And one of the reasons why I'm so, now I'm really, I have to say, I'm addicted to workout. You know why? Because I'm so concerned about the longevity. Based on the finding, based on the evidence, if we have enough muscle, we can prolong our longevity. You know what is the reason? When we have more muscle, we're going to burn more calorie, our basal metabolic rate will be higher. Okay? And then, for your information, every year, starting age of 30, each of us, every year, we're going to lose 3 to 5% of muscle. Now, maybe most of you are students, maybe you'll not notice about this. But for those who already past 30, you will notice. You remember when you was young, you was able to jump quite high. Okay? I was a volleyball player. I can jump very high. I was a main striker, okay? I can jump very high. But suddenly when I back again, 30 something, suddenly I noticed my performance drop. Okay, my performance drop. Why I cannot jump as high as before? It's due to that we lose some of the muscle. So that's why now I'm really serious doing weight training. Right? Now, even I told my parents, you should go to the gym. And they are ready. Luckily, they are ready. Do you think, okay, what do you think? Which muscle that's the most important you should be training? Huh? If you go to the gym, which part of muscle, most of the guys, they like to train? They want to train upper body because they want to be bigger, right? But according to evidence, the most important muscle is your thigh and also your glutes. Okay? And you are lucky if you are start to train early. The good thing if you do weight training is you can build your muscle, and the second thing is you can build your bone, you can strengthen your bone. I would like to give you a not reminder, not warning, but just to let you guys know, especially for women, you should train, you should do weight training as young as possible. Because your peak bone, if not mistaken, around age of 30. After age of 30, they will stop, how to say, growing your bone. It will, and starting from 30, because maybe of your estrogen become low, it will lead to low bone density. And for your information, there is high prevalence of osteoporosis. I got listened to one podcast by medical doctor. Most of the women, when they get older, they will get hip fracture because they have a very weak bone, and also they don't really train their lower back. Actually, women, why they have a very high risk of osteoporosis? Due to many reasons. They have monthly blood loss through their menstrual, and also for breastfeeding mother. On average, if they really perform breastfeeding, they will lose around 300 to 500 grams per day. It's like maybe if we contribute 10% of bone loss. But I'm not discouraged a woman mother to perform breastfeeding. I'm the one that advocate for that. Okay, your mother should perform breastfeeding because it's very beneficial. But then they have to replace those calcium that lost through their breastfeeding. They should replace with the dairy product and so on. All right. I read one journal regarding the nutrition for enhanced productivity. So I try to make it simplified. Based on this journal, they said there are two main factors. Number one is unhealthy eating behavior. Number two is physical inactivity. So I think Mr. Desmond already covered a lot on the aspect. Maybe I focus more on physical activity. Okay, before I got prepared some stuff about the healthy eating concept, but I think already covered by Mr. Desmond for me to replace. Okay, a lot of my friend, my client, which kind of health eating habit or diet we should practice in our life? Nowadays, there are a lot of type of diet, right? We have ketogenic diet, we have intermittent fasting diet, we have Atkins diet, we have so many kind of diet. Okay? I want to give you one tip, very useful tip. You can choose those diet that has been proven that lead to higher longevity. Okay, if I ask you, in this world, which country that have the longest, the highest longevity? Yeah, correct, Japan. But the latest one is Hong Kong. I checked, Hong Kong. But there is one population Anybody around the world cannot beat them. There is one population in Japan, we call it Okinawan people. There is a small island in Japan, which is Okinawa. So I am really interested on this. I used to give talk before about Okinawan dialect. Maybe I can simplify a bit from my previous talk. Most of the Okinawa people, mostly they eat fish every day, rather than meat or chicken or other things. You know what is the advantage of eating fish, marine fish? Number one, they are lower in fat compared to meat, compared to the others. This is number one. Number two, fish, they high in omega-3 fatty acids. Omega-3 fatty acid, their function is it can act as an anti-inflammatory agent. Okay? So our body always producing free radical. When we stress, we're going to produce a lot of free radical. So by having enough anti-inflammatory, especially omega-3, we can fight the free radical. If we just let go, let the free radical accumulate in our body, the dangerous thing is it will damage our internal organ without we aware. Okay, so that's why it's very important for us to consume those food that are high in anti-inflammatory, or in other words, omega-3, and also antioxidant. Okay, antioxidant. The most famous one is vitamin C, vitamin D. So that's why it's very important for us to have enough vitamin C. So the most easy way for you to get enough vitamin C through by having fruits. How much you should take fruit in one day? How much? You should take 2 servings. Later I'm going to show you how much was serving, because different type of fruit they will have different serving. Maybe for example like apple, one medium apple is equal to 1 serving. Orange also one serving of orange is equal to 1 whole. But for papaya, 1 slice. For watermelon, 1 slice. For grapes, 8 small. So later I'm going to show you the detail. Okay. So let me proceed. This one I think I will skip ahead about the healthy eating. Okay, I want to touch a little bit regarding the food that high in saturated fat and high in cholesterol. Okay, sorry. Because I want to relate with my own story. 2018, now 2024. I joined UTAR 2019. Just 1 month before I joined UTAR, my dad got heart attack, and he already performed the bypass surgery. The doctor cut the chest, and he take the blood vessel from the leg, from here until here. So before the surgery, my dad need to shift everything, and then the doctor asked to shift both sides, because there is maybe if in case the one side not working, they can use another side. If my dad here, he can show you the scar and the scar. What I want to say here is my dad he's not really eating fast food. He's not like eat those like sweet beverages. He's quite concerned about the food. He eat real food, but then he only, in terms of the protein, he only eat meats and also seafood only. If we go to restaurant, we ask, you got chicken or you got other thing or not? He don't eat chicken. I only want to eat beef and also seafood. Okay, when I take this course, I got some knowledge, then I give some advice to him that please cut down your intake of meat and seafood because they are high in cholesterol. And after that, he showed me this another 2 kg of fish. Me as a son, we cannot, how to say, scoop, or we cannot, to say, so it's okay, we just give advice on it. But 2018, suddenly, one day, in our house we have 2 stories. I stay at the second floor. Around 3 a.m. My mom knocked the door. 3 a.m. Then I open my door. I saw nothing. My mom already go down. And then I go down. I saw my dad on the living room. It's He's sweating. I'm very panicked at that time. 3 a.m. But luckily my mom quite okay, quite stable. My mom said, okay, you change your clothes, you bring that, go to hospital. My dad said, oh, very painful, very painful. Then I pressed my cup into maximum. On my way go to hospital, my dad said, I think I will stay until here. I said, wait. The hospital just said another 5 minutes. I'm very panicked and very nervous. So when we reach the hospital, we have to check. And the specialist told me, your dad need to perform angio today. You cannot wait. Angioplasty. Okay? And after he performed the angioplasty, the doctor said, your dad, all 4 channels, all blocked. Okay? Can you imagine? My dad don't eat fast food, don't eat anything. Despite concern about his food, but it happened. It can happen. Okay? So we have to be really careful with our diet. That's why I'm so scared. I'm so scared. That's why I pushing myself to practice healthy myself. Okay? So before the talk just now, I got discussed with some of the community. I explained about regarding the saturated fat and also cholesterol, because there is some misunderstanding among the public. Okay? I want to ask you before I give my answer. If we consume fried foods like fried banana, fried chicken, is it good for our health or not? Why? Huh? What's wrong with the saturated fat? It will lead to blockage. Okay? It will lead to increase of high cholesterol. Okay. One thing I want to tell you is this is common misunderstanding. Cooking oil, they are plant-based. Every plant-based, they contain 0% of cholesterol. If you go to supermarket, you see the cooking oil, they be clean and 0% of cholesterol. But why we cannot eat fried chicken, fried rice? This is the tricky thing. Okay? Our body, 70 to 80% of our blood cholesterol produced by ourselves. And only another 20 to 30% come from the diets. Okay? So, why we cannot take the saturated fat, the cooking oil, the fried chicken, fried banana? Because by having saturated fat in our body, it will trigger more production of cholesterol. That's why we have to limit the fried food as well. Okay? So, this is the list of the high saturated fat, like cooking oil, animal fat, margarine, fast food, coconut milk, and so on. Okay? When I be transferred to, when I start to work in Kampa, when I want to have my breakfast, first day I eat fried meat, second day I eat fried bihun, third day I eat nasi lemak, fourth day I eat roti canai. Until one day I cannot tahan. It's not because I'm picky, but because I have no more choice. So I start to buy my own brand. I start to prepare my foods like that. Because when I started to work in UTAR, I'm gaining some weight. My cholesterol spiked as well. So it made me thinking, I want to proceed like this, or I have to do something. So after I cannot tahan, then I prepare my own breakfast. Okay. So I think I can skip this one. Okay lah. When we talk about the productivity, we can use specific food for you to provide you lasting energy. Okay. In sport nutrition, we are really concerned about how we can provide the most optimal energy supply to our athletes. Okay. Okay, you have to know that the energy system in our body. Energy system, our energy system started it comes from the smallest unit, which is ATP. ATP, protein, after that glucose or carbohydrates, and after that protein and fats. Okay, and most of the time our body will use energy come from our glucose. Glucose or carbohydrate outside we call glucose and we call carbo, but when it enters our body, it will be either it will be circulate in our blood in our blood circulation as glucose, or it will be stored as a glycogen. Okay, so in sport nutrition, we have one concept. We call it as a glycogen loading. Okay, so that's mean when our athlete want to go for competition, we want them to have a very maximum energy. Okay, let's say to a few days, maybe next week I'm going to have competition. So I want to be most energetic during the competition day. So normally we're going to do carbohydrate loading. So normally we're going to increase our carbo. We're going to reduce the physical activity. So our body will store more glycogen. Okay. What I want to say here is, for general population, I will encourage you to have complex carbohydrates rather than simple carbohydrates. But for athletes, we have to prescribe both. Okay? Like me myself, before I start my workout, I will take some consider high glycemic index, which is something like maybe banana. It can provide quick energy. Okay? But for the breakfast, for the normal people, I would encourage you to take some carbo like rice, bread, but you have to mix together with some protein and also some vegetable, because after you combine them, so their GI will be slightly low. So you cannot take only, you cannot take solely the carbohydrate. You have to combine. Okay. So after you combine, it will be lasting. You can do your own experiment actually. Next morning, you only eat bread. I think after 1 hour, you get napa already. But then if you try to mix with the egg or some vegetable, it will be lasting. Okay. So this is the other example. I try to make it faster. Let me touch a bit about this processed food. Okay, I know all of us like processed food. We like burger, we like sausage, and so on. But surprisingly, the finding from the research, they found that all processed meat, like sausage, burger, and so on, they are definite cause for cancer. I always share this one story to my students. Last time when I did my clinic internship, I still remember one of my patients. He's still young. I think Form 3, 50 years old. He got bone cancer. First day I met him, I go to his bed inside the ward. I tried to perform 24-hour daily call to review his intake. I interviewed and he said, okay, I eat blah 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 blah, and it sounds very okay one, not too healthy, but okay, no problem. But I tried to slow down, talk, and finally he revealed his secret. He said, every night at 12, after the parent go sleep, he will start to go to the kitchen. He open the refrigerator. Inside the refrigerator, they have some burger, they have some nuggets, they have some sausage. So he start to fry, and he eats every day. And then I say, oh, maybe this one is might be the cause that lead to this. And after I read the finding from the Cancer Research Center, yeah, it is proven. Okay, so please, especially parents, don't buy fast food. Don't let fast food exist in your house. If one of my family member buy this fast food, will be scold for everybody. My dad will take and we throw away. Okay, because it's really really dangerous. Okay. Okay, I think this one already covered by Mr. Desmond just now. Okay lah. I think I'm going to end another few more minutes. Okay. So actually this is my main discussion today. Just not just introduction. No. I just try to make it simple. So in order for us to have a good productivity, or in other words, we want to feel more energetic. Based on the literature, they suggested that there are two main factors. Number one is physical health. Number two is mental health. Okay, physical health, that's mean our body. Okay, how we can be energetic. Number one is we must have efficient and adequate energy production or energy supply. Okay, so each of us actually we have different energy requirement. For our dietetic student, we teach them how to calculate accurately how you can determine individual energy requirement. They can use a few formula like Harris Benedict, Mifflin, and so on. Okay, but for normal population, for based on RNI, for men, it's range from 1,800 to 2,500. It depends on your age, it depends on your physical activity. But for women, it's slightly lower, around 1,600 up to 2,300. Okay, if you guys interested to know detail, you can find my student as my dietetic student. They know how to calculate. Okay, number one is efficient energy production. Number two is to have a good physical health, we must have good muscle strength and also endurance. So in later slide, I'm going to show you how we can build some muscle and how we can have an optimal muscle movement. Okay. The third one is due to we must have blood circulation. This one maybe you kind of a bit blur what's mean by the blood circulation. In order for us to digest our food, to move, everything, our cells, they need oxygen. So one of the main important function of blood circulation is to bring oxygen. We inhale, so it will attach to our blood, right? It will bind to hemoglobin. Right? So this blood will circulate around our body and it will provide to all cells in our body. Okay? It's very common among anemic patients that have anemia, that lack of red blood cell. One of the common symptoms that we have shortness of breath. Why? Because they lack of oxygen. They have low volume of blood, so their body cannot circulate. The blood cannot bring enough oxygen to the whole part of the other parts of the body. So that's why they will get suction of breath, and then they easily get tired as well. Okay. And the third one is we must have a good immune function. Okay? Okay. Maybe I would like to focus more on this, on mental health. Because this is my current, focus. I'm doing my PhD. I'm testing one of the foods effect on mental health. Have you know that? Have you heard or not? Gut is our second brain. When I first discovered this one, I also a bit wonder why, how come gut become our second brain? So when I do my own reading, so actually there is a good explanation behind. For your information, in our body, there are some microbiome that are responsible to produce, we call it happy hormone. Okay? And based on the finding as well, those people that have gut problem, like inflammatory bowel syndrome, okay, they have strong association with the stress and anxiety. I can show you later. I'm going to show you some evidence now. And it happened to my mom as well. Just now I shared my story about my dad. Now my mom's so healthy. I think she has better than me in terms of the diet. I think she knows. I think some knowledge she know. I don't know as well. She's really concerned about health. But suddenly, 2 years ago, 3 years ago, she kena attack, she kena COVID, and starting from that she got non-stop burping. Very severe one. Starting from the morning until night, she cannot sleep. Until I need to bring her to the emergency, doctor will give some IV pantoprazole. Only with pantoprazole, the symptom just disappeared. Doctor already give the best medication. If not mistaken, Mr. Desmond, in our government hospital, they give generic first, right? Only specialist can give the original, right? The original, we call it original, right? Yes. And the price for original is very expensive, and only specialists can prescribe. Okay? The doctor already give the high-end drug to my mom. It's not working until she received the IV pantoprazole. I still remember every day I need to bring my mom to emergency. His hand already become bushes, full of scar of the needle. Sometimes I got quite itchy. And then I think I come from Kelantan. I sent my first, because of the emergency, we sent my mom to government hospital. After that, I transferred to another private hospital to find a better specialist. Specialist performed the endoscopy, colonoscopy. Everything was normal. The surface is normal, just like slightly reddish only. And until then, I asked the gastroenterologist, "What's wrong with my mother?" The result is everything was normal. I gave up. I need to transfer your mom to another hospital to my friend. Then transfer. And another few more thousand to spend, to burn. And until one day, one of my professors in USM tried to bring your mom to one of the gastroenterologist meeting. I don't get any profit from that center, just to share with you. There is a good gastroenterologist, very experienced, Dr. Andrew. Yeah. He got a gastro center just behind the Pantai Hospital. So when I brought my mom, he said that my mom keep burping non-stop during the session. My mom keep burping. He said that I think I need to do another colonoscopy and endoscopy for your mom because I want to really work out what is the problem. But I need to spend more than 10,000 again. I think I already spent lots of money, more than 30,000. I think more than 30,000. And then I said, is it possible we don't want to perform colonoscopy because we already spent a lot of money. And he said, okay, I give you second option. You take my medication, and then we see how. Then I agree. When I receive the medication list, 90% the same. They give me ibuprofen, Nexium, everything the same. I remember everything already. All high-end drug, except one thing. There is he picks up my mom one probiotic from Taiwan. I forgot the name. Not expired. It's quite pricey as well, but it's working. After several weeks, my mom consumed that probiotic. Suddenly the symptom stopped. Starting from that day, I'm start to take serious about the probiotics. Me myself as a dietitian, we know the benefit of the probiotics, but we take it as a granted, right? Starting from that day, me myself, I start to at least once a week I will take probiotics. Okay? Maybe I touch about the probiotic first, before later we go back. Okay, so maybe you can try to memorize. This is very simple. There are several happy hormones, like serotonin, dopamine, norepinephrine. Okay, I want to share with you one study. Okay, one study, they found that which one? Okay, serotonin. 90% of body serotonin is synthesized in our gut. You see how important the gut health. That's means if you don't have enough serotonin in your body, that means it might be due to something wrong with your gut health. Okay, and according to finding as well, 40 to 99% person with inflammatory bowel syndrome, the person that got some gut problem, they experience some degree of anxiety and depression. Depressive symptom. My mom also got anxiety. Until one day, all my siblings, we interview one by one my mom. Mom, do you have something that you worry about? What are you thinking? Don't think so much. He said, I have nothing. I don't think anything. It just happened. I just have the anxiety. At that time, we still don't know that actually she got some problem with his gut. Okay, and it is based on there are a lot of study has been proven that consumption of the probiotics it can give some beneficial effect on the gut health, especially it can reduce some inflammatory and oxidative stress markers. Okay, so if you ask me how long you should take probiotics, some study they found that by having probiotics supplementation for 8 weeks, it significantly decreased some kind of depression. 8 weeks. 8 weeks around to 2 months. Okay. Another study they found that around slightly longer. So when you take probiotic, don't expect you're going to have a quick result. It takes some time, maybe after 2 months or after 3 months. But day by day, you will notice you get better actually. Okay. Okay. I want to focus on this because this is quite important as well. A lot of people they don't realize that actually having enough muscle is important. But after I do and I explore myself, I could say weight training is a compulsory for everyone. Because without weight training, you can't really gain enough muscle. Maybe if you do some normal exercise, you still can gain muscle, but not efficient. Me myself, actually, I don't want to get big like a huge body. I'm not interested on that. Just want to have some amount of muscle, just for my longevity only. I'm interested about longevity. But then maybe we can how to say plan our training. Like me myself, in training they have a few type of training. They have a hypertrophy training, which is focus on increase the muscle. They have a functional training. Functional training, that means we focus on movement, flexibility, everything. Maybe they have a lot a lot type of training. My training is now I focus on hypertrophy. After I already gain certain amount of muscle I start to change to function because I want to play sport. Right? Sometimes when I share my photo to some of my friends, especially my badminton friends, so don't get bigger, don't get too big. I want you play. I want you. I still want you to play badminton. If you get bigger, you cannot play badminton. Okay? But they don't know. They don't know I can give up. My focus is actually just to get some muscle for longevity. After that, I focus more on functioning. I focus more on jumping and so on. Okay? So when we start to do weight training, we have to change our diet, especially in terms of the protein. Okay? Because when we do weight training, we need to break down our muscle fiber. So we have to take more protein to promote the muscle recovery. Okay? So for normal people, normally we, as a dietitian, we need to prescribe around 0.8 to 1 gram per kg body weight. So let's say if your weight is 70 kg, so you need around 70 grams per day. But if you do weight training, you have to take a little bit higher. And it's not easy actually to have a high protein diet. Number one, it requires if you have good appetite, no problem. But some people they don't have good appetite. Number one is you need have a good appetite. Number two is costing lah. Costing. But then if you really serious to build some muscle, you have to increase your protein lah. So like me myself, I just take more eggs. I take egg in the morning, and the other meal time I just take fish or chicken. That's it. Just to maybe just top up a bit the protein. And I noticed a lot of guys inside the gym, I think 90%, they take protein supplement. Because protein supplement is proven to be effective to promote muscle growth. But I'm kind of, how to say, a bit conventional. I'm scared. I'm scared to consume any food supplement. I'm scared. Until today, I never take any protein supplement. I never take any drug. I just depend solely on the food only. And I'm happy with what I'm doing. I still manage to get some good amount of muscle. Okay. Other than protein, we should know that our muscle it requires some other nutrient, which is calcium, potassium, and magnesium. This one for muscle contraction. Okay. Because of this, I want to share with you one important, useful tips. You can notice a lot of elite athletes, if their game longer than 1 hour, they will consume banana. Why? Because banana, they high in potassium. When we have enough potassium, it will prevent from the muscle cramp. It can improve the muscle contraction. Okay? So me myself, I will make sure in my kitchen, in my refrigerator, there will be always banana. We have to know that when we do regular exercise, I drink a lot of water. When we get sweaty, it will, excrete our electrolytes. So one of the important electrolytes is potassium. So I want to make sure I have enough potassium. I don't want to get cramp. I will eat banana, 2 to 4 banana per day. And mostly I eat banana as a pre-workout because it can provide quick energy as well. Okay. So in case some of you really motivated and now you want to start do some weight training, how you can do your weight training? This is a good study actually. They compare between three groups. One group, they go with the heavy load. That means you train with a very heavy one, like 70% of your maximum strength. The second group, they use low load. That means they go very low. And the third group is controlled, they don't perform anything. So based on their finding, if you notice, both groups using heavy load and also using low loads, both promote muscle gain. But if you notice, the one that use heavier loads, they gain a little bit more muscle. However, in terms of body fat loss, those who are using low load, they lost more muscle compared to heavy load. So it depends on your goal. If you want to focus more on muscle building, I will encourage you to go for heavy loads. If you want to focus more on fat loss, you use lower, but more repetition. Okay. So you can train. Actually, you can. No need for you to perform to do weight training every day. 3 times per week is enough. And weight training, you need rest. You need rest. You gain your muscle not inside the gym. You gain your muscle when you're sleeping, when you are in recovery. So that's why for you to have a good enough muscle, you have to train correctly, you have to eat correctly, and the third one, you have to sleep enough. If you don't sleep enough, you will not gain muscle. Me, myself, I noticed when I start to do workout, previously I just sleep around 6 hours. Now I need like 7 or 8 hours because I need more time to wake up. If I sleep less than 6 hours or less than 7 hours, I feel a little bit tired. Okay. Okay. I want to touch a little bit about the this one. Just now I already explained regarding the blood, right? We should have enough blood. Another thing is we should concern about endothelial function. Endothelial function means how healthy our blood vessel. Our blood vessel should be able to dilate and also contract, so that it can circulate our blood. If we call it as arterial stiffness, that means it cannot really dilate and contract, so our blood circulation will be slow. So what will happen when we have a slower blood circulation? We're going to lack of oxygen, we're going to lack of nutrient, because our blood will bring oxygen and also nutrient as well. If you feel tired, if you feel not really energetic, one of the reasons due to the blood circulation. We have poor blood circulation. Okay? So based on the finding, when we have a high blood glucose and blood lipid, it will reduce the function of our endothelial cell. That's why we must make sure that we must have normal level of blood glucose and blood lipid in our body. We cannot let it become high. If it's become high, it will decrease the function of endothelial function. What we scared is, if we have poor endothelial function, it will lead to atherosclerosis. This one is mentioned by Mr. Desmond. Atherosclerosis means the blockage of our blood vessel. If the blockage happens in our brain, it will lead to stroke. If the blockage in our heart, it will lead to heart attack. Okay? Last time I got one patient in one of the private hospitals. I cover one case in one of the private hospitals. His age just 40. He got stroke. But BP pressure is not mistaken to 100 something, over 100, 110 or like that. So because of too high reading, the blood vessel inside the brain burst. when I go approach him, I want to ask him, have you taken your breakfast? In order for him to apply, to say yes, it takes longer time. And his speech also become blurred. It's very dangerous. Right? So that's why we have to always measure our blood pressure. Me myself, because I have strong history of blood hypertension, I bought one unit, I put in my office, I measure every day. Because I scared my blood pressure spike. Okay. So this is some of the good sources for omega-3 fatty acid. Okay. So based on the police evidence, most of the marine fish, they high in omega-3 fatty acid. Okay. Okay, last one. This is the take-home message. Last one. I try to skip a little bit. Number one, you have to control your food portion. If you look at today, we bring our healthy plates. Our healthy plates. We can divide our plate into 4 portions. So 2 portions is belong to fruits and vegetables. 1 portion belong to protein. 1 portion belong to carbo. Okay, always practice. One tip for you: when you want to take your meal, take veggie first. Don't take rice first. Because some of us, because we are hungry, aku lapar, and then we tend to take more rice. When come to take veggie, no more space. Don't take lah. So we eat only rice and also protein only. So we don't have the veggie and fruit. So one of the tips is we take the veggie first. We take veggie and fruit first. And the latter, you can take your protein and your carbo. Okay, choose a food that low in fat and sugar. So you can practice something like healthy cooking methods includes steaming, boiling, grilling. So this kind of cooking method normally they use low amount of oil. So this one we cut down oily food and high in the saturated fat. Because it can lead to increase of blood cholesterol. Okay, next is try to choose food that high in fiber. Okay, in case let's say for the rice, you can opt for brown rice compared to white rice because brown rice they contain more fiber and more other minerals. But the bad thing regarding the brown rice, to be honest, the taste is a little bit less delicious compared to white rice. And in terms of the shelf life, I think it will not lasting. So when you want to buy the brown rice, you just buy a certain amount only that you think you will finish within the time. Don't buy in bulk because it will be tap water or bad, it turn to bad quality. Okay. Okay, for the bread, maybe you can opt for those that high in fiber, maybe whole grain bread is better than white bread. Okay, and even now some company biscuit also they produce high in fiber. You can opt for this rather than normal biscuit. Just try to our best to increase our fiber intake. Okay, I know everyone we like snacking, especially when we do our work in our office, including lecturers. If you buy how to say chips or anything as your snacking, and you see after a few months what happens to your body. So we need to choose wisely our snacking. My favorite snacking is fruits and also nuts. Me myself, I will buy every week. I go to supermarket. I will buy in bulk and then I will cut it into smaller pieces and then I will bring to my office like that as a snacking. And Sometimes I eat nuts as well. It's a good snacking, protein and some of the other minerals. Okay, if you go to supermarket, you can choose. Now they have another version. We call it a healthier choice. That's mean. What's mean by the healthier choice? They have the same product, but they have a less content. They have less amount in terms of sugar and some of the other sodium and so on. You can find this level. My choice. Okay, this is very good. This is last one. Okay, last one. You need to consume enough of water. How much you should take? How much you should consume water? At least 1.8 or 2 liters per day. If you don't have your own water, if you buy one big mineral water, you buy a big one. At least that one is 1.5, but okay lah. At least you need to finish one big mineral water. Me myself, I already bought my own water. It's 2 liters, so I make it as a compulsory. In one day, I need to finish one big water. But actually, for me now, because I'm doing workout, one big water I can finish within 2 hours. During my workout, I can finish. So that's why my recommendation is based on the recommendation for normal people, 2 liters per day, 1.8 to 2 liters. But for those who are physically active, you need to take 2 to 4, depend on your physical activity. I think my average is around 3 liters per day, normally. Okay, and when you go to a restaurant, please avoid to order sugary drink. If you want to something sweet, you order fruit juice, but don't add some sugar. Okay. One of the good drink, good option is coconut drink. You know why coconut drink is coconut water is good? Coconut water, based on the research, is equal to other isotonic drink. It contains electrolyte. Last few months, there is one of my friend. He's a sports scientist. He's a lecturer from RWC. He participated. He is athlete. He involved in running and so on. During the competition, he fainted, and then after he was sent to the hospital. Right? I think 1 day or after 2 days after the event, he came to Copenhagen because he got some problem. He is a deputy team actually. He's my friend. And then I asked him, what happened to you? I don't know. I just fainted. And then I guess maybe he dehydrated. I asked him, did you consume enough water? Yeah, I did, sir. I did. I did a lot of water. Okay, he followed me. I know his problem. I bring him, visit one small store, selling the coconut drink in the evening. And after that, he's staying at the resort. So, come, take me. I want to go to the supermarket. Where can I get coconut drink? Coconut water. Oh, we got in Lotus. I want to buy it. He told me that after I drink coconut water, I feel like more energetic, more awake, like that. I know. Maybe he lost a lot of electrolytes. So coconut drinks is a good option compared to other isotonic drinks because it's natural, it's less in sugar. Okay. If you are someone that really cannot control your habit of having sweet drinks, you can opt for artificial sweetener. Okay. But if you are the one that not really, how to say, on sweet drink, I would not encourage you to start using. Just in case you are someone that's always having sweet drink. Mostly when I have a friend as an insurance agent, the one that's how to say, always meeting people. Normally they will meet their client at the cafe, so they will order sweet drink, right? So they can replace that. But nowadays, we have our natural sweetener like stevia. Now you can find any product. Maybe in your pharmacy you also got, right? Last one is perform exercise regularly. Okay, based on the recommendation, if you are perform moderate intensity exercise, it is recommended to have 150 to 300 minutes per week, which is around 2.5 to 5 hours per week. If you are performing vigorous activity, intense exercise, it is recommended to have 75 to 100 minutes per week. Or in other words, you can exercise 3 to 5 times per week. Okay. Like me myself, I will do my brisk walking and jogging like 4 to 5 times per week before I do other sport lah. And then I will do my resistance training 2 to 3 times per week. Now I got injury, I focus on workout only. And then I also replace my favorite sport currently is badminton. Okay. And last one, perform a regular health checkup. Like me myself, I will perform my blood test every 6 months. So the best is every three months. Nowadays there are a lot of private lab that you can do your blood checkup. If they list you, if they have some discount, I think with $50 you already can get complete already considered okay lah. So perform blood test every 6 months, monitor blood pressure regularly, and you can monitor your body weight once a week. Okay, I think that's all that I want to share. Thank you very much.
Thank you, Azizo, for sharing your invaluable expertise and practical insight with us today. After listening to you, I think I should start doing some working from now on. Okay. Ladies and gentlemen, we will now continue with the Q&A session. Dear physical participants, you are now welcome to ask any questions if you have. Dear online participants, you will send your questions to the chat box. Any questions? We will ask to our two esteemed participants. The speakers. Let me check the chat box. Dear speaker, I do have one question. Okay, this is for me. Now there are many tea drinks, so-called zero sugar, right? Nowadays, but the label, I saw the label is stated that it has sweetening agent. So what does it mean? Is it equivalent to regular sugar? Lesson?
Usually for sweeteners, it's like what Zoe was shown. So basically, it can be 0 calorie, but sweeteners all depends. They do a few types. This is the natural one. We're using the stevia. The stevia, the aftertaste is slightly bitter, but we are using the conventional, the eco type. But long run, to be honest, sweeteners we don't really encourage. But like even in Australia, all these sweeteners, they will put long-term using is cancer causing. So we want to use sweeteners, use the natural, as I said, stevia type, which is better, safer, even long-term would be okay. They're all 0 calorie.
All right, thank you, Mr. Desmond. Any questions from the online? Oh, okay. There's one question from the online participant. Okay. Hello, I'm Mincy from Taylor's University. I would like to ask, in your opinion, do you think zero Coke, is it healthy? Zero Coke. still
But
sweetener.
I think they're using aspartame. Aspartame long term is like equal no good. Yeah, aspartame, zero coke, of course, is zero calorie. Of course, it won't affect your sugar level, but still, we would say aspartame too much is cancer causing. Because they have done the research and saying like long term using aspartame, you might not see the effect right away. But how about 10 years, 20 years later, chances to have cancer very high. So basically, we don't advise.
Thank you, Mr. Desmond.
Any more questions?
Physical participants, do you have any questions to ask? Ah, Mrs. Jane, yes.
What about vegetarian chicken, vegetarian mutton and all this?
Okay, thank you for the question. I'm lucky to become the panelist for my FFP students. They was exploring the plant-based meat product. They have good thing and they have bad side as well. Most of the what the common issue is, most of the product they high in sodium. Even though they are how to say sounds little bit healthy because they are plant-based, but the bad side is most of them they high in sodium. You have to consider. And another one is we should concern about the preservatives they use. Maybe for daily, for me I will not recommend. Thank you.
Thank you, Azizo. Any more questions? Okay, I think I have one more question. Yeah. Can we actually replace water with pure green tea? Pure green tea.
I would say, I mean, from our research or studies, at the end of the day, water is still the best fluid, for our body. Of course, green tea, it does have its own benefit. High in antioxidant, they do have flavor, phenols, things which is good for the body. But still, on hand, I do have one customer, after drinking long green tea for a period of time, he said like having gout attack. But how true is that? I don't know. But as long as I know green tea, it won't affect. But he said like after using, because he used it daily, like what you've been saying, I don't know whether he did check his other food intake. But he said like after using a green tea daily without drinking water, 6 months having gout attack. But you may try, but I don't know whether it will affect you. But to us, as a healthcare professional, we don't recommend just drink other beverage. But water is still the best form of fluid we need for our body. Yeah, thank you.
Thank you, Mr. Desmond.
No more questions. Okay. Alright.
All right, now I think we can end the Q&A sessions. All right, now we would like to present the certificate of appreciation to our esteemed speakers, Mr. Desmond and Enzo. So, Mr. Desmond and Enzo, could you please come forward? Ms. Jane, Dr. Wei. Thank you very much. So now we would like to proceed with the group photo session, right? So participants, would you please come forward or maybe move to the center? Yeah, anyone? Could you please move to the center? Then we are having a group photo. Now for online participants, we will take screenshots. All right. Feel free to turn on your camera.
Let's do some testing. Okay, this is nice. Okay, ready? Put the camera. Ready? 1, 2, 3. 1, 2, 3. Hey, what's so calm? Okay. Okay, 1, 2, 3. Put the thumbs up. Okay, ready? Yeah, ready? 1, 2, 3. Nice. Okay. Online. Ask everyone to turn on their camera. Turn the camera and then you stick the your.
Okay, online participants, could you please turn on your camera? We are going to take a screenshot. Now, student, you may need to sign out, yeah, for your USSBC points.
The code to do the coding.
Okay, so
Anything they can answer.
yeah, okay, so for that,
Or maybe I can help to print screen if you want.
all right, now participants, could you please sit again at the center? Right, we are going to take a screenshot together with the online participants. Okay, online participants, please turn on your camera.
Wow, I cannot. Seriously cannot. You could do only like the normal. I mean, we did the first one.
Only the first one.
Only the first screen. Only the first screen. Okay.
See, Maria, you go to the first screen. I think it's not possible to accommodate anyone. Or is there any way to make it? No.
There's something on the chat box.
Just close the chat box.
Let's go to the first screen and focus on the first screen.
Okay, it's fine.
Okay. So everyone move to the seat. Which one is the print screen button? I know. Okay, control and print screen. Okay. Okay. So okay. Go to
go to your seat and I say 1, 2, 3. Okay, everyone, ready? Okay, 1, 2, 3, thumbs up, everyone. Okay, 1, 2, finish screen. Okay, yes, I think I.
Yeah, that's right.
Okay, participants, you are welcome to please fill in the survey now via the QR code given on the screen. Right? If you have any questions, you may feel free to contact Mr. Desmond. Now, dear participants, you may sign out now for you to claim your CPD point, especially for UTAR students and UTAR staff. UTAR student, please sign out to claim your USSBC points. Our dear external participants will be given an e-certificate afterwards. So that's all for this talk. Thank you for participation and have a good day.
Tadi itu Mr. Tang sudah ambil screenshot kan? Dan kita sudah ada cek 6.
Thank you so much. But I will the link is there, right, in the WhatsApp group. The link is there in the WhatsApp group, right? So we ask because I didn't sign up. Maybe if they ask for recording, then we can give it to them. Maybe some of them might ask for recording. Oh, no need to post, is it? Oh, yeah. Oh, okay. 6 of us, including me. Because you see the first one, education. Also education. What about you? Oh, education. I thought only one.